is a workshop by Adjunct Professor Dr. Prem Kumar Shanmugam, founder and CEO Solace Asia and founding member Asia Pacific Certification Board. Please give him a round of applause.
Okay, morning everybody. Dato Halim, it's going to be impossible to beat that talk, so I'm going to keep mine really short and sharp. You know, before that, Sorry? Oh, okay. So thank you, Dato. Thank you very much. But before Dato leaves, I just want to say a quick 3-minute story about how I was introduced to Dato Halim. Yeah, just quickly. When we started Solace in 2003, it was very difficult for us because we were a private institution and we were the first, I think, at that time, doing international treatment with bragging about our clinical team and about the science we had and all that. And we needed a lot of support from the ministry. And we tried talking to different people from the ministry, and it was difficult because the ministry or the government agencies were not very receptive at that time because they thought, wow, these fellows have a lot of money, they're private, they're big, they're international, and they were not very receptive. And one day I get a call from Dr. Halim's office, and he said, he wants to meet me. And I was quite anxious when I went to see him because this is the Director General of NDA of Malaysia, right? And I walked into his office, and you know what he did? He actually came up to me and gave me a hug. That itself, like you were saying, the stigma, when you talked about stigmatization, that was a huge relief and a big motivation for me that at least I know we are getting support. And there's someone that recognizes the efforts that we were doing. I think 2 years after that, there was, or maybe in 2008 or 9, I can't remember, NDA did a survey of all the rehabs in Malaysia, the 66 rehabs that Dato mentioned, and they came to evaluate the rehabs for the work everyone was doing, and Solace got a 5-star award from NDA, which is the 5-star. And that was another big motivation for us. Then I went to see Dato again, and I asked him, Dato, what can we do? What can we do to help others and share the knowledge that we have? Because we do have a good team, and they come with a prize, so let us share this. And he encouraged us to do training. Dato actually encouraged us to start sharing this with all the AADK, the NDA staff, the personnel, the other rehabs. And that's how Solace Academy was born. So Dato, thanks to you actually. You motivated the academy. Thank you very much, sir. Thank you for coming, Dato. Thank you. Okay, so my talk today, and my slides don't work. Oh, okay. So I'm talking about a topic which is close to my heart, family and addictions. And I'm going to try and keep it short, not too long, so we don't run out of time for the other speakers, yeah? I can talk a lot. So I'm going to try and keep it like a discussion so you guys can ask questions and we can take it along. One important part of treatment that many of us struggle with is families. Yeah, I think all those in the treatment industry will agree with me. And that's because we tend to forget that families play an important role in that whole dysfunctional system of addictions, yeah? And we tend to focus a lot on the person itself or the patient themselves. Before that, I thought I'll quickly say there are 2 major types of addictions. Okay, I know the last 1.5 days we've been talking mainly about substance addictions. And today I understand that nicotine addiction is the most addictive substance in the world, followed by coffee, caffeine, followed by nicotine. These are all the various types of substance addictions, yeah? Then, of course, we have the other family of addictions, behavioral addictions, gambling, sex, internet, gaming. Over the last 2 years, we have seen a spike with internet-related, gaming-related addictions. Even in Solace, we're receiving more people seeking help for behavioral addictions. Behavioral addictions have been known to be a little bit more complicated as compared to substance. Substance is not so difficult, you can remove the substance. But with behavioral addictions, how do you remove internet? How do you remove the phone? How many of you have kids here? Kids. How many of you give the kids your laptop or the iPad? They cry. Yeah. So it's difficult because it's become convenient. I've actually seen in Singapore a Prem, yeah, where you put the iPad for the babies. okay? Very convenient. The baby is in there, you just put the iPad in, the baby never cries. Right? So behavioral addictions have been known to be a bit more complicated. I'm going to skip the stats. Dr. Andrew touched on this yesterday. I'm going to skip on this because we touched on this and this and this. Okay, let's go straight to families. There's quite a few publications, research on what we call AFM. I did a paper on this, and it was interesting to find out about affected family members. What does that mean, yeah? Affected family members basically mean family members that the dysfunction that happens in the family as a result of the person or the individual who's addicted. So we look at it as a system, a structure, okay? Father, mother, brother, sister, uncle, auntie, and then in Malaysia we have extended families as well. So a whole system that's functioning. Now the addiction is a virus, right? It comes and creeps into the system. Then when the system is affected, it locks up. And people try to take care of each other. And sometimes this codependency happens and people tend to overprotect each other. Now when things get really difficult, police or illnesses, sicknesses, then the families are forced to seek treatment. So we pluck out the sick person, we put him in treatment. Now we are cleaning up the sick person, right? What about the family system? What about this dysfunctional environment that has been going on for years and years and years? Now all these people have learned to communicate with each other as a result of the addiction. We need to understand that. Lies, secrets, not going out for social events, hiding from relatives, hiding from family members. Why? To keep this secret. You pluck out this ill person, you treat this person, you put him in a washing machine, you put him in rehab, and then you clean him up, you put him back in an untreated environment, what's going to happen? Sorry? How do you know? Okay, relapses. The chances of relapses are very high, right? Because you need to treat the whole system. So affected family members, or here it says AFM, basically means that, right? Now, there are various stages that happen with family structures as well. Attempts to reorganize, reorganization without the addict, recovery and reconciliation. And this can happen when the addict is in treatment. The way they communicate. Mothers, sisters, I'm using ladies because we see a lot of codependency happening with ladies, especially in the Asian culture. They don't want to tell the fathers or the husbands what's going on with the son or the brother. They keep it a secret. And when they keep it a secret, they lock it up, there's something that's happening to them as well. We'll talk about that. Now, these are some studies that were taken globally. There is a rise in AFMs globally, the rise in addictions. And I think, again, I say I think because I don't see any publications over the last 2 years, that there is definitely a rise as a result of the pandemic as well. Mainly because people were stuck together during the lockdown. And we saw a rise in family violence over the last year. We have seen a rise in divorce cases last year. Imagine stuck in a small environment for 2 weeks, 3 weeks, communicating with each other, trying to understand and accommodate each other. When you're so used to being at work 8 hours a day, 10 hours a day, and then you come back in the evenings and then you sit down and have dinners. And when you do have dinners, everybody's down with the phone and texting and messaging. No one talks. Yeah, we don't talk. But then when you're stuck with each other, you're forced to communicate, you're forced to talk. So as a result of that, we did see people getting into difficulties and struggles, okay? Here it says there are 100 million family members affected by loved one's addiction. Oxford's publication in 2013. Global, okay? 2 to 10 affected family members per person, which means that if you have one person who is afflicted by addictions, there are 2 to 10 people around him or her who is also unwell. The system becomes sick as well, which again, we're not treating, yeah? We're forgetting about them. AFMs can reinforce the addiction or the dysfunction. What does this mean? The secrets, the lies. And this reinforces the addiction further. Because what you're doing, we hear stories. My son comes to me and asks me for $50. I have to give him. Why do you give him? If I don't give him, he'll go and steal and get into trouble with the law. So by giving him the $50, what do you think is happening? He's still going to go and take drugs, right? He's still going to get in trouble with the law sooner or later. But it's difficult for them to see that. Yeah, it's very difficult for them to see that. So they think they're saving the family member. Sometimes we tell them, you know what, it's okay, let him get into trouble. It's okay, let it get difficult, because then the rock bottom happens and he's forced to seek treatment. It's a difficult decision to make for the family member. Now, I'll tell you, there are lots of stories. This person comes and he's psychotic, okay? A young patient. The family comes, and says that, you know, my child is da-da-da-da-da, and he's hallucinating and he's delusional, he's paranoid. He's thinking the neighbors have planted cameras under the ground, cameras in the ceiling, and his laptop is bugged. Paranoia, right? And it's not uncommon with stimulants, ice. Then I tell the parent, you need to get him into hospital immediately. He says, no, but he's not willing to. Now, the thing is, if he's psychotic, how is he going to be willingly seek treatment? He doesn't see he has a problem. So how will he ever want to get treatment? Then the parent says, involuntary treatment does not work. How many of you guys think involuntary treatment or treatment has to be voluntary? Can I see a show of hands if you think that treatment has to be voluntary? Does treatment have to be voluntary to work? Okay, how many of you think treatment can be involuntary in order to work? Yeah, I think so too, okay? Especially in these cases where people are mentally incapable of making decisions, we have to make the decisions for them. Sometimes that's where the law comes into it helps as well, yeah? Now, coming back to that point, yeah, AFMs can reinforce addiction and dysfunction. When they are unable to make the decision for their loved one, the dysfunction continues. Nobody gets treatment. Now, most treatment models for AFMs are designed and evaluated for high-intensity centers. So rehabs, of course, we are in the private sector, so it makes it a little bit more easier for us, because we tell the family members, you know what, yes, we take your money, we're willing to treat your loved one, but in order for us to help him or her, we want you to be involved in the process as well. If not, it's going to be difficult. I know besides Pengase, is anyone else here from a rehab background? How are your struggles with treating families? Are they engaging? They do participate, eh? Okay. Andy is from Singapore. Sorry? Okay. I know the Pengase guys do some really good work with family programs, right? You have workshops and all that. Now, we used to have workshops monthly before, where we get the families to come in, and quite a few of our family members are from abroad, the Middle East, Emirates, and they would actually come. They'll actually come, they'll spend the weekend, they'll go through a full-day workshop, and then we hand over the loved one back with them, and then they discharge. It worked really well until the last 2 years. No airlines, no flights, so that has stopped. Treatment includes psychosocial factors, psychosocial-cultural factors. Now, this is really important, and I think the speakers yesterday and today touched on this as well. When I say psychosocial-cultural factors, we need to understand that treating someone from the Western region may be different from treating someone from the Southeast Asian region. And yesterday, our speakers, I think Fiona mentioned about Aborigines as well. We talked about it. They have different expectations. Even sitting with a patient, say a Malaysian who's 70 years old or 60 years old, right? An elderly person walks in. We have the tendency to stand up out of respect. That makes a difference already. You're creating a therapeutic relationship. You're creating trust. Most of us in therapy do not cross our legs, right? Because in our culture, crossing the legs may mean authoritative or could even be disrespectful as well. So these socio-cultural nuances make a difference. Of course, in the Western regions, it's okay to cross your leg because it shows you know what you're talking about. Am I right? Yeah. Or no? Andy's nodding his head. So understanding and appreciating these cultural effects makes a difference. So earlier you mentioned BOMO. Now, sometimes, if it helps, I think it's okay. If it's helpful for the family to believe, to get them to engage, or to get them to create the trust or relationship. Now, we use a very non-faith based, I say non-faith because we cannot include any particular faith or religion. Well, often the families come to us and they say, we want our child to see the priest, or we want a child to see the priest, or we want him to observe going to mosque and prayers, and we're okay with that. We've got no issues with that at all. But we cannot make it compulsory or mandatory to include it as part of our treatment program. So we need to appreciate these cultural factors. I'm going to skip this for the sake of time, yeah? Perception, assumptions. And sadly, it's still happening. Of course, it's way better. I have to say it's thousands of times way better than it was. Yesterday, I think Prof. Igna was talking about if shoes get lost outside your house, the drug addict stole my shoe. Okay, now it's not so bad lah. You go to temples to pray, don't put your slipper outside. You come out, your slippers will still get lost. So not only drug addicts steal your slippers or shoes. So perceptions are staying, but the reality is, this is what's happening today, which we don't realize, or we are ignoring to see. My dog watches TV at home. Yeah. Strangely, she loves to sit in front of the TV and she watches. I've taken a video of her sitting and watching. I don't know what she's observing, but that's how we are, and we cannot avoid it lah. Okay. Sundays you go out for dinners, family dinners, or you get the whole family together. Oh, let's spend some time together. It's been a busy week. Let's all sit down and talk together. What do you do for dinner? Yeah, under the table, right? Texting, right? Yeah. So this is the reality of today. Yeah, it's more complicated than we know. Hallmarks of dependence. I'm sorry, I know I'm rushing through the slides, but that's because I want to give time to the other speakers. Please come up to me and talk to me anytime. I think this we have discussed this earlier. Dr. Halimoto talked about it. Now, belief system. I will end after the next two slides. Belief system goes back to what Dr. Halim said, yeah, the stigmatization. And this is a very difficult part to change, because not only for the person who's addicted, but also the family member as well. I have failed. I have not been a good parent. I wish I had da-da-da-da-da-da-da. I should have done da-da-da-da-da-da-da. We hear this very often, right? Treatment providers, you hear this very often. But the fact is this, and what I like to tell them sometimes is that, you know what, you think you failed because your son has got an addiction problem. What if your son had diabetes, or your loved one had hypertension, or your loved one had a heart problem, God forbid? Would you have considered yourself a failure? Would you have considered yourself as a bad parent? No, right? The fact is because your son has a disease, or your child has a disease. Your loved one has an illness. It's called addictions. So if people can appreciate that addiction is a disease, it makes it easier for them to understand that treatment is possible, first of all. Secondly, you're not responsible for it. It's not your fault. Unfortunately, your loved one has succumbed to this disease, or your loved one was predisposed to this disease. Okay? Oh, this is my favorite slide. Belief systems are induced into upbringing. Belief systems we instill them in our loved ones. Do you agree? Do you guys agree? How many of us tell our loved ones, when you grow up, you must become an addict. When you grow up, you must become a thief. Or how many people actually put up their hands and say, hey, I want to grow up and become an addict? Nobody, yeah? It happens, yeah? This story is actually my story, lah. My mom is here, so I have to be careful with what I say about my mom. When we were young, my parents are teachers, both, retired teachers, and it was important for us to do very well in school, right? You must get 100. If you don't get 100, you die lah. Indians, you're either an engineer, lawyer, or teacher. If not, you're a failure. Are you guys familiar with this? If you don't grow up and become an engineer, you don't become a doctor, or what else, or lawyer, you're a failure. Anything else is not accepted. Belief system. We put in these belief systems, and sometimes when these kids grow up and they're unable to meet those belief systems to excel, they look at other means to excel as long as the belief system is met. So if I'm good in drinking, It's okay because I'm good in drinking. If I'm good in drugging, it's okay because I'm good in drugging. If I'm good in gangsterism and the gangsters and the mafias or the gangs accept me, it's okay because I'm still meeting the expectation of being the best or being good. Okay? I always share this story, and some of you may have heard it. Maths was my weakest subject, and I had to get 100 for maths, right? I was in primary school, and I'd come home, and I think the first exam I got 89 or 90. And Mommy, I got 90 for maths. And she's like, what? 90? You're a disgrace to the community, blah, 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 blah. Fair enough. Next semester, next exam, I think I got 95. Mommy, I got 95 for maths. Only 95? That's all? So, there's something happening to me, right? Belief system happening, right? Now, I remember the last exam, I must have been in standard 5 or standard 6. Last exam, I had 98. So I was so happy. Oh, no, I had 100. Sorry, I got 100 marks, full marks. I was so happy. I came home, I kicked my shoe, school shoes, and I threw my report card on the table. I said, Mom, report card's on the table, go take yourself. And she goes and she opens and she sees 100. What do you think Mommy said? Guess. Finally? Okay, another guess. Sorry? Good job? Another guess, one more, last one. Make sure you get 100 for every exam, okay? Expectations, belief system. So it's already instilled in my head. If I don't do well, I'm a failure. If I don't get 100, I'm a failure. 99 is fail, 100 is pass. Belief systems create a very big impact on upbringing. Belief systems have a lot to do with your self-esteem. Many of us identify ourselves with our careers. I think all of us do that, which is not ideal, yeah? But sadly, we do that. And sadly, that's how the expectations are around us. And when things get difficult, drugs and alcohol become an easy way to boost or to create an artificial self-esteem, to boost it, okay? More complicated when some people are predisposed. Not everyone becomes addicted when you start taking drugs. Some of you may drink alcohol, some of you may, I'm sure there are one or two of you would have experimented with cannabis or drugs. But not all of us will be addicted. A small percentage of the population. And sadly, we don't know what that percentage is. Okay? Bio, psycho, social, spiritual illness. That's what addiction is. And it not only is bio, psycho, social, spiritual for the addicted person, but it's also bio, psycho, social for the families. There are biological predispositions for families as well. Psychosocial predispositions for families as well. Belief systems being a big one. And spiritual predispositions for families as well. When I say spiritual, I don't necessarily mean faith or religion, but I'm referring more to self-esteem, values, moral values and things like that, okay? When we treat the addict, if we don't treat the structure of the system, it collapses, okay? I'm going to end my talk here, again, for time purposes to allow the other speakers. Am I allowed to take questions?
Yes, we can have a Q&A. Any questions from the audience? Yes, we have one question.
Mr. Benedict, Mike.
Yeah. You can pass the mic, yeah.
Thanks for that talk. It's very insightful. I just want to ask one question. In terms of mending family relationships, I understand that forgiveness is a very key element to have in mending relationships, especially when there's an addict in the home. How would you journey with family members to facilitate the process of forgiveness? Thank you.
Thank you, Benedict. There's such a thing as the 7 C's, yeah? I can't remember all 7 of them. I'll see what I can remember. You don't cause it, you can't control it, and you can't cure it. These are the 3 C's I remember. So importantly, families need to understand that you didn't cause it. It's not your fault. This is something that your loved one had. It's a disease, if it's diabetes or hypertension, would you blame yourself? No, right? So it's not your fault. So if we can start and educate family members that it's really not your fault, and your child or your loved one is unwell, I think it starts that process of forgiving myself. It takes a long time. Too many emotions involved.
Right, next question from the audience. Yeah, we got 2. Can get the person in front. Yes.
Hello, Dr. Prem. I'm Sharon Howell. Thank you very much for that wonderful discussion. I really appreciate that, and I'm teaching students in medicine, so the biopsychosocial approach, not addiction MBBS students. But I just want to ask you, resilience is very much the buzzword these days in the field of psychology, specifically positive psychology. So resilience, how do you see that fitting in to your program? I'm sure it's there already, but how does that fit in specifically?
Okay. Thank you, Sharon. Let me try and answer that.
Sorry.
I think one key factor that we try and share with not only families but also with the person in treatment is boundaries and assertiveness. These are two key words that we try and use as often as we can, because we teach the families that, you know what, you can love your loved one, you can care for your loved one, you can feed them, you can medicate them, but you can't cure them, right? You can't treat them. So you draw your own boundaries, you take care of yourself, and you be assertive about it, and allow them to take care of themselves, because it's their responsibility to take care of themselves. And I think that resilience comes there as they learn to manage the boundaries and the assertiveness.
Okay. Thank you very much. Thank you.
You're welcome. I hope that made sense, though.
Yes, yes.
Because very often, resilience is also something that is comes with the psychosocial, cultural systems as well, right?
Yeah.
Yeah. It also goes back to the belief system also.
Yeah, it does, because it's all about being able to bounce back from experiences, and it's linked to coping as well. So it's kind of like the buzzword these days, this resilience.
It's a buzzword.
Positive psychology, yes, yeah. Seligman's work. So that's very interesting. Thank you very much.
Thank you.
Thank you.
I think we have one more question, last question for the session.
Hello, Dr. Prem. I'm Jason from UCSI, and it's a very insightful presentation. But I have a question in the sense that from where I came from, in Penang, and maybe it's because my exposure, when family is when the children is under drug addiction, right? Family normally don't accept them that much. And then the reason for those drugs addiction occur in the children is because mainly from the family problem. So you mentioned earlier that if you just restructure those behavior, but the main root of problem is not solved. So under this case, because I'm fairly new in this, how do you actually reach out to voice out the concern to the family about helping these people?
Okay. Thanks, Jason. When you said, thank you very much for a very interesting talk, but I thought, oh, your dial, I said something wrong. He said, but. Thank you. I think it's not only a problem in Penang. I think we see this worldwide. I think it's a common issue everywhere in most cultures. Malaysia, okay, not Malaysians, but I think in the Asian context, we are very, what's the word for it? What's the opposite of individualism? Collectivism, thank you. So we are very collectivist. So we are a lot of enmeshed relationships and a lot of codependency that happens. In fact, that part of my slides later was supposed to talk about that. And we get involved in each other's lives a lot, okay? Continuously, it's not only when we are kids, but also as we grow up also. I have to tell another story about my mommy here. My mom still checks on what I eat, my wife cook for me healthy food or not, did you sleep on time or not? Codependency, right? A lot of these things happen because we live in a very, in this society. Now, in individualistic society, it's not that I'm not saying an individualistic society is better, individualism is better, but I'm saying there are pros and cons, because then you're able to draw boundaries. You're able to say, you know what, this is the last time I'm going to help you, and this is what I'm able to do for you. After this, you need to sort things out on your own, and you draw those boundaries, and that helps. Okay. Was that your question?
So how do you actually, in a sense that you are reaching out to help, like you voice the concern to the family? Because from where I came from, the family, how to say, very poor in the sense that they don't really want us to care much because they have this history. So how do you actually reach out to help them?
Okay. Again, that goes back to drawing boundaries. I think that would be the best way to do it. That means you need to sit. What we do is we have treatment for the patient as the IP, identified patient, and then we have treatment for the families as well as a support system. Okay? So we educate the family members to make them understand that what you're doing is actually not helping the addiction, but encouraging the addiction. You are conditioning the wrong behavior. All right? You need to change. If you don't change, he won't change. If the relationships don't change, you're not going to help him or her to change. Goes back to educating the family members. Okay? So when we work with addictions, there are a few things, a few people we identify as patients. First is the person who's addicted. Then is the family. And sometimes there's such a thing as the extended family also, or the significant other. The partner, the friends, identify people who mean a lot to this person. And they can become a very good motivational hook to help. Yeah, it's difficult, huh? It's a process. It takes a while. Earlier, I was having a chat with a friend of mine, Prof. Asrul, and I don't know if he's here now. And he said something very nice, He said, people, going back to sustainable recovery, going back to our main theme, okay, or harm reduction. People, sometimes we feel obliged to save someone, thinking that person is drugging or taking alcohol and destroying their lives. So we jump in and try and save people, Okay? It's not your obligation to save, but it's your duty to help reduce the harm. Right? You get what I mean? Yeah, it's our responsibility to help reduce the harm or make it sustainable. But it's not my duty to jump in and save the person and tell him, oh, you cannot take drugs, you cannot take alcohol. Yeah, that made a lot of sense, so it's ringing in my head. I just wanted to share that.
We have one more question online, Dr. Prem, you can see it on the screen.
Can a child still flourish in a family with addiction? What do you guys think? Sorry, yes? Why is yes? Why is it yes?
It comes from the belief system. And in a family, there's still exposure to other content outside. So the family may not be the system that they support. But then, as you mentioned, there's significant others that may be supportive as well.
Yeah.
So there are other forms of support that a child can obtain, but depending on the age as well.
Yeah, okay. I have to agree with Mesh. Can a child flourish in a family with addiction? I would say yes. Why not? That would be a better answer. Why not? It doesn't mean that a child only flourishes in a family with no addictions, right? Any thoughts on that? Can a child flourish with in a family with addictions? Yes or no? Guys, anybody? Quick thought.
You can raise your hand if you want to say something. We can pass you the mic.
Do you hear success stories of people who come from an addiction background and being very successful? You do, right? So the answer is definitely yes. If not rehab treatment providers, we won't have a job to do already after this. Okay.
All right, I think, yeah, we're done.
Okay, thank you very much. Please feel free to catch any one of us. We have our counselors and psychologists here as well from Solace, so we are very happy to answer any questions. Thank you, and sorry I had to cut my workshop short.
Thank you so much.